Hello, everyone, and thank you for being here today. Today's presentation is a part of the Howard University and the Black Doctor Network's The Struggle is Real, Affirming Our Strengths in the Black Community series. And it's truly an honor to discuss a topic that's so close to my heart, reimagining the future of Black youth mental health. As a Black woman, I approach this topic not only from my academic, expertise, but also from lived experiences that, resonate very deeply with the challenges that our youth face today. And so in this presentation, we will explore, those issues and opportunities that shape the mental health journeys of Black youth. But we'll also focus on how we can collectively build a future, right, where their resilience is celebrated, right, and their needs are met. But before we get into the presentation, technical difficulties, I think we're going to get the presentation back up. Thank you. So I'm just going to introduce myself. My name is Dr. Sandra Jeter. I am an assistant professor at the Howard University School of Social Work. I'm also the principal investigator for the Project Press grant, and my research focuses on the intersection between Black student mental health and academic success. And the Project Press grant that I mentioned, it centers on training the next generation of Black school social workers and training them to tackle systemic inequities and provide culturally responsive care. And the purpose of this, right, is for them to help in improving mental health outcomes for Black students. So my motivation to do this work, the research and the grant work that I do is inspired by my own lived experience, right? Growing up, I didn't always see mental health framed in a way that felt accessible to me or relevant to my community. So that's one of the reasons why I'm so passionate about this work, and I'm so excited about this presentation today, right? Because it's not just about research or about policy or about programs, right? It's about lives. It's about our youth. It's about ensuring that they feel seen and they feel supported, and that they have everything that they need, whether that's tools or resources or people or spaces, that they need to thrive. So throughout this presentation and every day, right, when we think about mental health, it's important for us to understand that it's more than just a diagnosis, right? It's about how we are able to navigate life. It's about our emotional well-being, the resources that are available to us and sometimes not available to us. And it's about the systems that either support us or, hinder our progress. So, this conversation today is about breaking down barriers and reimagining the possibilities for our Black youth. So, as we move through, today's presentation, um, I invite you to really think about how we all can, contribute to this vision. So here's just, a roadmap of the presentation. First, we'll unpack, the status of Black youth mental health, the mental health crisis that is affecting Black youth. And this includes, looking at the data and understanding the lived experiences behind those numbers. And then we'll examine some of those, systemic, cultural, and social barriers, such as stigma, right? But we'll understand how they are barriers to equitable care among Black youth. Um, I think it's important to note that the barriers that we talk about, right, like they don't exist in isolation, but they're interconnected, and understanding all of them is the key to creating effective solutions. And then from there, we'll explore some, community driven and culturally responsive, right, or grounded solutions that really, prioritize the strengths of Black communities and, the resilience of Black youth. And then finally, I'll close with, a vision for a brighter, more equitable future for our youth. So first, I want to, talk about the problem. Black youth are living through a mental health crisis, right? Studies show that nearly 1 in 5 Black youth experience a mental health disorder, yet less than a quarter of them receive the care that they need. And so I do want to note that although these statistics come from nationally representative data, Black youth are more likely to experience underreporting of their mental health issues. So that number may be, much higher than that as far as how many of them actually have disorders. But also, misdiagnoses are excessive among Black youth, and they're only growing, right? Behaviors that stem from trauma, like impulsivity or, acting out, right? They are often mistaken for conduct disorder in Black youth instead of, you know, those behaviors really being truly understood and seen, for what they are. And these racial disparities, right, they are also found in suicide rates. So, for example, between 2018 and 2022, suicide rates for Black youth aged 10 to 19 skyrocketed by 54%. And even, this was happening even as rates among their white peers fell by 17%, right? So these numbers are horrific. And they demand our attention, but they also demand our action. But like stated earlier, right, we're not just focusing on the numbers, because these numbers alone, they don't tell the full story. The racism that Black youth face is a consistent factor that leads to, these mental health outcomes and worse mental health outcomes compared to other youth. For example, a study conducted by Michael Lindsay, who is a Howard University School of Social Work graduate, but he's also a national leader of Black youth suicide research. That study found that racism leaves Black youth at a higher risk of suicide. And unfortunately, Black youth encounter multiple racial microaggressions and systemic racism daily. Specifically, they encounter 5 acts of racism a day. So imagine that, right? Imagine hearing or experiencing 5 racially charged incidents a day. Some of us don't have to imagine it because it's real life. And we know that this takes a toll on anyone's mental health, right? But imagine a child who's still developing their identity, their understanding of the world, and then add that to the racism, and the broader systems, right? I think looking at all of that together, right, it identifies a need for tailored and, culturally affirming interventions, right? That need is clear. But I think it's important for us to note that there are gender-specific mental health issues that need to be explored, right? When we look at Black girls, they face a unique set of challenges that lead to mental health concerns, and we can't ignore it, right? Because it's been ignored for so long. But of the limited research that is out here, we see that Black girls are often seen as older and less innocent than their peers. And that's a phenomenon known as adultification bias, right? And you can read more about adultification bias in the Girlhood Interrupted report that was conducted by Rebecca Epstein from the Center on Policy and Inequity at Georgetown Law. And there's a part 2 that came out as well to kind of dive deeper into that phenomenon. But adultification bias leads to harsher punishments for Black girls and for behaviors that are linked to trauma. And then when you look at Black girls and compare them to other girls, they're 6 times more likely to be suspended than white girls for the same behaviors. And these suspensions and this adultification bias, right? It not only isolates them, but it disrupts their education and it disrupts their mental well-being. It fuels the school to prison pipeline and it heightens their risk for depression and anxiety. Black girls experience gendered race based discrimination, and that also heightens their risk for mental health issues. For example, they experience when they experience negative messages about Black women, which, let's face it, most of them, probably do. But when they experience those messages, they also experience, negative feelings about being Black and more symptoms of depression. And then we look at depression and see that it's a risk factor for suicide, right? And between 2001 and 2017, suicide rates among Black girls aged 13 to 19 increased by an alarming 182%. Right, that's a huge number, right? But remember, these aren't just statistics. This is real life, right? These lives were lost because our systems failed to see and support Black girls as they are. But we have, programs like Embrace, which was developed by doctors Rihanna Anderson and Howard Stevenson. And it's based on Dr. Stevenson's racial empowerment collaborative model. But this program focuses on racial socialization and resilience building, right? And so it shows how culturally responsive interventions can make a difference, right? Could literally save lives. But we'll explore Embrace a bit more later in the presentation. I also want to talk about Black boys, right? Black boys are navigating this world that often labels them before they've had a chance to really define themselves. Before they even know who they truly are, the world has already told them who they are, right? And that's aggressive and defiant. Misdiagnosis and underdiagnosis are most rampant among Black boys, right? So instead of receiving the mental health support that they need, they're, disproportionately being, misdiagnosed with behavioral disorders rather than mood disorders like depression or anxiety, right? And this not only limits their access to appropriate care, the care they need for their actual diagnosis, but it also perpetuates harmful stereotypes that they are violent and dangerous and that they're troublemakers, right? And that influences how they're not only treated in their schools, but also how they're treated in communities and in the juvenile justice system. There are serious consequences for these disparities and for how Black boys are treated. When we look at suicide rates, again, we see that Black boys' suicide rates far outpace those of their peers. They are 2 times more likely to commit suicide than Black girls, right? We just heard about that horrible statistic, right? 182% increase in suicide rates among Black girls. But Black boys are 2 times more likely to commit suicide than Black girls. So despite these alarming trends, their depressive symptoms and other, mental health challenges that they experience, they go unacknowledged and they go unreported for multiple reasons, right? One of them is the stigma surrounding mental health, which we'll talk about a little bit later. Um, but that combined with, not only the effects of them being raised and socialized in the patriarchal system, and how that impacts their mental health and their health seeking behaviors, but also the systemic barriers to care, right? All of these things combined leave many Black boys feeling not only isolated, but very unsupported. Um, However, we must recognize that Black boys are not problems to be solved, right? They are young men with stories to tell, with lives to live, right? And so we have to think about programs that can help them build their futures. And programs like Play, which is the Preventing Long-Term Anger and Aggression in Youth program, it was also developed by Dr. Stevenson, but that program demonstrates the power of community driven approaches, right? To help boys regulate their emotions in productive ways. And so this program teaches boys how to, manage anger and develop emotional resilience, and just have tools that can help them navigate a world that often misunderstands them and undervalues them, right? And it's also important to talk about Black LGBTQIA plus youth, right? And intersectionality plays such a huge role with all of these youth, but especially, this subgroup of Black youth, right? Because these young people are navigating the overlapping challenges of not only racial discrimination, but homophobia and transphobia, right? And they're navigating it in a system that sometimes intentionally, right, fail to affirm their identities. And the research that we see consistently shows that Black LGBTQIA plus youth experience higher rates of depression and anxiety and suicidal ideation compared to their heterosexual and cisgender peers. And so, you know, with that, we must also talk about another factor that impacts, their mental health and why their rates may, be much more higher, right? And that's family rejection, because family is very important. It's a crucial support network for people, right? But that family rejection that they experience further, compounds the challenges that they face, right? Many Black LGBTQIA youth are disowned or ostracized by their families due to their sexual orientation or their gender identity. And that leaves them without the critical support networks that are essential. And this rejection, it results in isolation. It results in, feelings of worthlessness, but it makes it that more difficult for them to seek the help that they need. Yet there is research that shows that affirming spaces, whether they're in schools or churches or peer groups, right, they make a huge difference with this, subgroup of Black youth. Um, for instance, schools with inclusive policies such as E.L. Haynes Public Charter School in Washington, D.C., they have a division of the Gay Straight Alliance, or, even universities like Howard University, that has the LGBTQ plus resource center, right? It provides Black LGBTQIA plus youth with a sense of belonging and safety. And initiatives like these help reduce not only the stigma, but harmful environments as well, right? Having these programs and initiatives create environments where youth can express themselves authentically without feeling like they're going to be judged or disowned, or discriminated against. So we've established a foundational understanding of the mental health landscape among Black youth. So now I want to talk about those barriers to mental health care among this group. And first, I want to discuss stigma because we talked about that a bit earlier in the presentation. And also because stigma, in Black communities has historically been a significant barrier to mental health care. Many people internalize the belief that seeking help for mental health, you know, is a sign of weakness, right? And that thought is fueled by cultural narratives such as, the independent woman or strong Black woman, right? Those narratives that emphasize resilience and self-reliance. In our community, we also say things like, give it to God and pray about it. And, from firsthand, I know that that can bring peace in very tough situations. But it also may create, an environment where seeking professional help from licensed mental health professionals is often stigmatized. One study highlighted the critical role that community leaders, play in breaking down these barriers, the stigma barrier. Faith leaders, for example, right, can use their influence to normalize mental health discussions by integrating it into sermons, prayer groups, or workshops. And we'll talk about that a bit later. But I have seen this being done firsthand, and I'm eternally grateful for it because, faith leaders do have a lot of, influence in the community. And so for them to normalize it through, sermons and through conversations is important and it's impactful. So let's also talk about racial bias in mental health care because it's definitely a barrier as well. Like stated previously, Black youth are often misdiagnosed with, behavioral health disorders such as oppositional defiance disorder or conduct disorder rather than being diagnosed with mood disorders. And this leads to ineffective treatment, right? And these misdiagnoses stem from racial biases, and these racial biases frame Black youth behaviors as inherently problematic rather than symptomatic of underlying mental health challenges. And so this leads to ineffective treatment plans, right? A lot of those treatment plans may focus on discipline rather than healing. And that can also lead to disengagement from care, right? And these consequences of these racial biases are far reaching because we're talking about misdiagnosis, right? Misdiagnosed youth are often funneled into the juvenile justice system. We talked about the school to prison pipeline a little bit earlier, but not just, the juvenile justice system, but, alternative schooling, rather than receiving the therapy that they need. And so this not only exacerbates the mental health struggles, but it also diminishes their opportunities for, you know, academic and social success. And it reinforces that generational mistrust in the health system that we've seen in Black communities. Just a second. Um, so we're talking about racial bias, and a huge reason, for these racial biases in the mental health field is that lack of cultural responsiveness, right, in the mental health care system. I know we hear about cultural competence, cultural humility, cultural responsiveness a lot. We do, but they aren't, they're not just buzzwords. Like, they're important. They are a necessity, and we cannot afford to play about this, right? People lives are literally on the line. So, we need more cultural responsiveness in healthcare. Mental health care providers have to be trained to recognize and respect, right, and honor the cultural and social context of their patients. And so that includes understanding where they come from, the communities they come from, understanding systemic racism, understanding community violence and how all of this impacts, mental health, understanding those economic disparities and how they impact Black youth. For example, right, a provider who understands the impact of racial trauma on behavior, right, is more likely to identify symptoms of PTSD rather than mislabeling Black youth as defiant or aggression. So yes, that training is very important, but also diversifying the mental health workforce. That's also very important because representation does matter. I remember, during the COVID-19 quarantine, there was a huge need for more Black mental health, professionals, because more Black people were seeking support and they wanted people who looked like them, who understood them. So representation, it does matter. Um, when Black youth, right, see providers who share their cultural background or have been trained to understand their lived experience or has the same lived experience that they have, right, or similar, it fosters trust, but it also fosters engagement. They are more engaged with people who can understand them, who see them. Um, Nationally, right now, there is a shortage of mental health providers, but the problem, that shortage worsens when we focus specifically on Black mental health providers. One initiative that we have at Howard University School of Social Work, that was developed to address that shortage of Black mental health professionals is Project Press, the program that I talked to you about earlier in the presentation. But this program seeks to increase the amount of Black school social workers who are effectively trained to employ a trauma-informed care lens in the work that they do with Black youth and underserved communities in Washington, D.C. And then there are also, economic and structural barriers to mental health care. And economic barriers specifically play a major role in limiting access to mental health care for Black families. And then those structural factors, right, such as housing instability or unemployment, and, lack of insurance, those issues disproportionately affect Black communities, and it creates significant barriers to accessing that care, right? Families facing financial hardship, they often have to prioritize those basic needs, like what are they going to eat, right? Where are they going to live? They have to focus on those basic needs before they can focus on, you know, healthcare, paying a healthcare premium. So that leaves mental health services out of reach for them sometimes. And then we also have to think about, right, the costs associated with therapy and medication and transportation to appointments. And those things even widens the gap even more when it comes to access of these services. And then Black families are also more likely to live in areas with, limited health resources. And those areas are often considered, mental health deserts because they don't have the resources or the sufficient providers. And then the providers that they do have sometimes are not culturally competent, right? So this shortage forces them to either travel long distances to receive care, settle for providers who may not see or understand who they are or like the culture that they come from, or not have um, mental health services at all, right? So none of those are great options. Um, but we have programs like, the Medicaid expansion, which is a provision of the Affordable Care Act, and it has shown some promise in increasing access to mental health services. Um, because it allows people to qualify for services based on income rather than disability determination. And so that can reduce financial barriers for some low income families. And then another barrier is, just the historical mistrust in providers in the healthcare system within the Black community. The historical mistreatment that Black people have faced, including unethical medical practices. It's fostered a deep mistrust in health systems, and it's very understandable. Black communities have long memories of systemic abuse, right? From the Tuskegee syphilis study to forced sterilization of Black women, right? These experiences have created a deep skepticism towards medical institutions. And this mistrust is further reinforced by that lack of representation among mental health providers that we discussed. This historical context cannot be ignored when we're seeking to understand and address mental health access and treatment, right? Because this context affects both service utilization among Black youth and their families, but also the quality of care that they receive. And again, to rebuild this, we must prioritize increasing that diversity in the mental health workforce. So if we look at the statistics, right, about 20% of social workers are Black, 11% of counselors are, 4% of psychologists, and 2% of psychiatrists, right? Those numbers aren't great. So we have to recognize that Black youth seeing providers who understand their lived experiences, it helps Black youth feel more comfortable seeking care. It helps them be more honest and open about their experiences. It also helps them to understand their experiences a bit more. So we have to increase the diversity in order to build that trust. And then, the last barrier that I'll discuss today is cultural barriers, right? There are cultural norms within the Black community that prioritize self-reliance, that we discussed a bit earlier, right? And it discourages help-seeking behaviors. And these norms, they reflect a legacy of resilience in the face of systemic oppression. And we can't forget to note that, right? We can't fail to mention that these behaviors have been necessary, in order for Black people to survive. However, they do contribute to the stigma surrounding mental health care. For many Black people, we go to our families first, our friends, our churches, our community members, community organizations. We go to them. They are the primary, source of emotional support for us. And while these systems are invaluable, right, we need them, they may also lack the resources or the expertise needed to address complex mental health issues like trauma. And so this reliance on informal networks, is compounded by those narratives that we talked about earlier that equate strength to silence. And so these cultural attitudes, right, while they are protective in many, many ways, they do create barriers. And so it's important for us to try to change the mindset, you know, and kind of, force a cultural shift that normalizes mental health care as an essential part of our well-being. And there are initiatives that are doing this work. And so it begins, right, with education and with awareness. And a big part of that may be, storytelling, right? For Black youth to hear stories from respected community members or peers who have benefited from therapy or who have benefited from utilizing other mental health services, right? That can, help confront stereotypes, but also encourage our youth to seek help. So now I want to discuss some of the solutions to this problem, and these solutions are rooted in community and culture. So first, I think it's important to explore leveraging our community strengths when we're building and enhancing solutions to the mental health crisis. Faith-based partnerships and community programs like Embrace that I mentioned earlier, they both exemplify how leveraging those community strengths can provide accessible and culturally relevant interventions. So let's look at Embrace specifically. The Embrace program is a very powerful example of how intentional community-rooted initiatives can support Black families in navigating systemic racism. Um, the program builds upon the racial socialization processes that are already occurring in Black family units, but it also encourages resilience building activities as well. And, it equips parents and young people with the tools that they need to really understand and process and counteract the effects of racism on their mental health. But this intervention, it doesn't only address those immediate challenges of internalized racism, but it also fosters that long-term, sustainable emotional health and self-esteem among Black youth. And then similarly, partnerships with Black churches have also proven to be highly effective in bridging that gap between communities and mental health services, right? Churches have long served as pillars, of support within the Black community. It offers not only spiritual guidance, but also, social and emotional resources. I think programs that, integrate mental health services delivered by licensed mental health professionals into faith-based settings, can build trust, and it can also build accessibility, being as though those programs will be held in the communities. We desperately need more collaboration between churches and community-based mental health programs. These programs can hold workshops or counseling sessions, but the support that they get will be tailored to the unique needs of Black families, and that's very important, right? Because these initiatives can start to or can help build, right, that trust between the community and mental health programs. And so investing in these sort of initiatives, it really ensures that the solutions that we're thinking about are not only effective and sustainable, but they're rooted in community and in the strengths of those communities, right? And in culture. And so programs like Embrace and then, those faith-based partnerships, they're successful because they're culturally relevant, right? They offer culturally relevant care. And then speaking of culturally relevant care, right? This care is instrumental because it ensures that Black youth see themselves reflected in their treatment. And so this means, right, that, their culture is acknowledged, the historical context that they and their families have, developed in is acknowledged, and how those contexts shape their experience is acknowledged as well. And so Afrocentric approaches, they're rooted, right, in culturally responsive care. And so these methods often, center cultural heritage and resilience, and they offer frameworks for healing, right? Healing, not punitive practices, but healing that deeply resonates with Black communities. For example, incorporating spirituality or self-determination into therapy is really big, and it can help youth kind of feel a stronger connection to not only their identity but their cultural roots. And then, like, activities like celebrating their achievements or engaging traditional art and music therapy can promote self-esteem among Black youth. And then another important part of culturally responsive care is family-centered care. Um, Engaging families in the treatment process often fosters trust, but it also helps to address those the generational stigma that we see within the community. You can involve parents in therapy sessions. You can explore how racial trauma plays out in family dynamics, but that can all lead to more holistic healing, but it also can lead to more help seeking among Black youth. And then lastly, what was mentioned a bit earlier, right, that storytelling piece is extremely important, and it's very, it's a tradition in Black communities. I know in my family, we tell stories all the time, and the stories may be different every time we tell them, but we're going to tell a story no matter, where we are or when it is. And so they're very powerful, right? And it could be a very powerful therapeutic tool, and it's already used in narrative therapy. But by integrating the cultural piece, the culturally relevant methods, mental health providers can really start to create those safe spaces that feel affirming um, for Black youth. And then another solution may be expanding youth peer support programs. In youth peer support programs, youth create safe spaces for their peers to really engage in mental health care. These programs are especially valuable for Black youth because they can provide a culturally affirming environment for Black youth to share their experiences or their challenges without the fear of being judged, um, or the fear of being abandoned, right? These groups kind of create a sense of community among Black youth, and it allows them to build trust among one another and trust, in mental health care. One of the research says that one of the most significant benefits of peer support program is just the ability for these programs to meet youth where they are, right? Because they can be held in communities, they can be held in community centers. They can be held in schools, and within these programs, youth don't have to be anything than who they are, right? They can just be themselves, and they're connecting with other youth who have similar experiences that they have, right? And so they kind of get this sense of belonging, and that reduces feelings of isolation as well, which would be extremely helpful for all youth, but especially LGBTQIA plus youth. There are some issues with peer support programs as far as them being underfunded and inaccessible to some people. So there is a need, right, for us to expand these programs and to invest in these programs. All right. It's also important for these programs to offer culturally competent training for the peers, right? And also, there is a lack of Black peer workers. So training more Black youth peer mentors is necessary as well, so that they can reach other Black youth. One way that we can possibly make peer support work programs more accessible is through the use of technology. I do not know how to use, TikTok and Discord, but I know that a lot of young people are using it. So incorporating these sort of programs into virtual platforms like TikTok and online forums like Discord can really connect youth across geographic boundaries. Um, it could create opportunities for broader networks of support, right? For example, you know, Black youth who are living, in urban neighborhoods can connect with Black youth who are living in rural neighborhoods, and they can share resources and share stories and strategies for dealing with mental health. So just expanding those networks is for Black youth is extremely important. And then just more effective diagnosing, right? We talked about throughout the presentation just the misdiagnosis or just underreporting period. And so maybe integrating more mental health services into schools and community centers, we've seen that to be you know an effective strategy, right? And so we know that schools are uniquely positioned to provide accessible care, as they are often the first point of contact for identifying mental health services, but also because they spend most of their time in schools. So routine mental health check-ins as a part of school health programs can normalize, but also I think increase help-seeking behaviors. But we have to remember that effective diagnosis begins with these routine screenings, but it is also necessary for more culturally responsive mental health screening tools to be used in these processes. And then the last, solution that I want to discuss is just the importance of policy change. Policy change is essential for reducing barriers to mental health care. This includes creating, more affordable and accessible services, um, and continuing to maybe expand programs like Medicaid and other insurance programs to, make sure that they're covering mental health services and other supports that will allow Black families and youth to access those services. We also have to address structural racism, right? Addressing that is really the way, right, to make systemic change when it comes to mental health care. And so we can do that by, increasing funding for mental health services in underserved communities and continuing to invest in programs like PRESS that seeks to diversify mental health care workforce, right? Policymakers have to also, work to invest in community-based programs like Embrace and church partnerships, right, that address the root cause of mental health disparities, but also that offers the culturally responsive support that Black youth need. So I did want to just share my vision before we go. Because I think it's important for us to have visions on where we want to see, Black youth mental health, right? And my vision is, of a future where every Black child, feels seen and supported and valued and empowered, right? And I think this vision goes beyond just addressing, the immediate mental health needs, right? But it's about creating a world where Black youth can thrive. They can progress without the weight of systemic barriers and stigmas that are detrimental to their mental health, right? But achieving this future, it requires all of us to be involved, right? To be intentional about the actions that we take to make change, right? Advocacy, education and direct support, they're all important. They're all powerful tools to affect change, but I believe that this only works if we combat this problem, collectively. So together, I believe that we can create a mental health system that affirms the dignity and worth of Black youth. So as I close, I like for you all to kind of think about one actionable step you can take to support this vision. It could be mentoring a young person in your community, it could be advocating for policy change, starting meaningful conversations about mental health with your community members or friends or families. And I want you to share it. You could share it in a chat. You could, share it, with your community, with your colleagues, because I think our ideas can inspire other people to get involved as well. And so, again, I want to say thank you so much for tuning in. And I look forward to seeing the effective mental health system that, we build together for our youth sooner than later. But thank you. Goodbye and take care.